Now, something more from cornea. So guys, I also consider keratoconus always. It's an important topic, not only for your FMG, but also for NEET PG. And I said keratoconus is supposed to be a very important topic for us. So can we answer this easy question here? The question says, which of the following investigations or results supports the diagnosis of keratoconus? So what is keratoconus? If you remember, keratoconus is nothing but a conical cornea, isn't it? It's a idiopathic condition. Remember, it's a idiopathic condition where the cornea is progressively becoming conical and there is also a thinning of the cornea, isn't it? There is a conical shape, there is a thinning of the cornea. कौन से age group में होता है? Please remember, this is around 50 to 20 years of age. Remember, it progresses till 30. After 30, there is no keratoconus. Like I can't have any keratoconus now, okay? So what is the complaint? If the cornea is unstable, what do you think will be the complaint? The patient will come to you with a frequent change of glass power. So a young person coming to you with a frequent change in glass number, please think about keratoconus, okay? Now, what do I expect? Which type of refractive error do I expect? Obviously, I expect an astigmatism, okay? Definitely, it is an astigmatism. But what else can I see? I can also see a myopic astigmatism. So this, in a way, is a correct statement, okay? Please remember, not only astigmatism, but we can also have a myopia here, okay? So both the things are important, okay? If they ask you only one, say astigmatism. If they ask you what are the refractive things which can be seen in keratoconus, say both astigmatism and myopia, okay? Both the things are correct. Now, whenever I do a keratometry, I don't see such irregular lines. I see normal, multiple circles here. But when I do keratometry in keratoconus patient, I see such kind of irregularity. So this gives me one of the easiest diagnosis here. But what are the other different signs in keratoconus that we have to remember? So guys, this is another image-based question. Do you remember what is the name of the sign? A very frequently asked question also, what is Munson sign? So Munson sign is nothing but the notching at the lower lid, okay? This is the notch which is produced on the lower lid by the conical cornea, okay? See, the cornea is becoming thinned also. Now, what else do we see? We see a line of iron accumulation on the epithelium of the cornea. And what is that ring? What is that line called as? This ring is called as Fleischer's ring. This is nothing but iron accumulation on the epithelium of the cornea, okay? Remember, we also have Vogt striae. Vogt striae are stress lines. These are vertical stress lines at the level of Descemet's membrane, okay? Another very important sign is oil droplet sign. So these are the signs which one should remember, okay? Munson sign, irregular keratometry, oil droplet reflex, Vogt striae. Now, how to diagnose? So please remember, for diagnosis of keratoconus, we have a special instrument that is called as Pentacam, isn't it? We call it the Pentacam. So what does the Pentacam tells us? Pentacam tells us about the topography of the cornea. So remember the term topography of the cornea. Okay, this may be an expected question for you all. What is topography of the cornea? This is a mapping, a colored coded mapping of the cornea, where we see one of the maps which gives us the power or the curvature of the cornea. One of the maps gives us the thickness of the cornea. Okay, so power of the cornea, thickness of the cornea, these are the two things that are seen on topography. Okay, now how to treat? What are the treatment options? I hope you remember. We can treat starting by initially temporary method is glasses, okay? Astigmatic glasses we can give. Second one is we can give rigid gas permeable contact lenses. Third is we